Namaskar and welcome to our special series on Eye Matters Daily. Did you know that glaucoma is one of the leading causes of irreversible blindness? It is estimated to affect around millions of people in our country. And what's more concerning is that most people don't even realize they have it until significant vision loss has occurred. Today, we'll be talking to an expert to understand what glaucoma really is and why early detection is so crucial, and how you and your loved ones can take simple steps to protect your vision. So let's get started and shed some light on this silent thief of sight. Doctor, recently I've been hearing a lot about glaucoma and how it silently leads to blindness. Can you help us understand what glaucoma really is and what are the most common risk factors leading to glaucoma?
Thank you. I am Dr. Elankumaran, Medical Director of Navashakti Netralaya, situated on Outer Ring Road, HBR Layout, Bangalore. It's a very important question, and you made it a point to call glaucoma as the silent thief of sight. That's good. Why is it a silent thief of sight? Normally, any diseases produce symptoms so that the patient can come to the doctor. But this is one disease which does not have any symptoms, particularly if it is an open-angle glaucoma. Suddenly one day, patient will notice that his vision is gone. And the problem with this disease is, it is irreversible. That's why glaucoma is called a silent thief of sight or a silent blinder. The second thing you asked about the optic nerve. Now let's see what an optic nerve is. Eye, if you look at this, can be considered like a camera. These two are the focusing lenses. This is the cornea, this is the lens. And then there is a retina where the image is focused. And there is something called ganglion cell layer in this retina which processes these images, and then those images are sent to the brain with the help of what is called as an optic nerve. So it is the ganglion cell layer which processes the images, something like your recorder in a camera, and this optic nerve is something like a cable you connect your camera to your computer. So without these two, patient will not be able to perceive what he is seeing. And I also made it a point, once this ganglion cell layer and the optic nerve is damaged, there is no way that it recovers. That is why it is important to treat this disease as early as possible, even before the patient develops any symptoms. Now, who are the patients who are at higher risk? Number one, patients who have had a history of glaucoma in the family. Number two, increasing age. Older people are more prone. This said and done, even younger people develop glaucoma. Third, if the patient has a high myopia, meaning high minus number glasses, sometimes even a high plus number glasses can cause glaucoma, but most often glaucoma is associated with high minus number glasses. Not only this, there are certain systemic conditions like diabetes, hypertension, kidney disease, or if the patient is taking any medicines such as steroids, or if he has certain autoimmune diseases. These are the diseases where the patient has to suspect or consult a doctor even if he has no problems.
So if I'm diagnosed with glaucoma, what are my treatment options? And will I need surgery immediately or are there any alternatives? Also, does the treatment differ from the type or the stage at which glaucoma occurs?
Not all patients with glaucoma require surgeries. Let's start it like this. Say you have a small disease. First you try to give medicines. That's what we do in glaucoma also. We give drops. Usually we start with one drop. And then if necessary, add 2 or 3 drops. Nowadays, a lot of combinations are available. So we can manage the 2 drops in one bottle itself with a single drop. Always glaucoma, the first line of treatment is medicines. There are two types of glaucoma, open angle glaucoma and angle closure glaucoma. In angle, in angle closure glaucoma, always the first line of choice is laser, followed by drops, followed by tablets. In cases where it is not under control, for a short time we give tablets, and for the long time we either use lasers, and only when none of these procedures fail, we take up the person for surgery. Except when the glaucoma is very advanced, we may think of a surgery from beginning itself. Even in surgery, there are certain surgeries called micro-incision glaucoma surgeries, minimally invasive glaucoma surgeries. So these are the surgeries we prefer in milder types of glaucoma. However, sometimes if the glaucoma is not controlled, we have to go ahead with a surgery called trabeculectomy. There are different types of trabeculectomy. Summing up, surgery usually is reserved as a last choice in severe cases of glaucoma which are not controlled with medicines or laser.
I've also read somewhere that there are certain simple signs like eye pain or increase in spectacle number that could be the early signs of detecting glaucoma. Can you help us understand these symptoms better?
That's a very good question, what you have asked. See, I told you there are two types of glaucoma, open angle glaucoma, and this is the tricky part. This is the silent thief of sight, where the patient may not have any symptoms. By the time he notices the symptoms, which is usually blurring of vision, it's already too late. There's another type of glaucoma called angle closure glaucoma. In these conditions, the patient will notice eye pain, photophobia, he cannot face the light, or halos around the light. Headache can also be there when there is a severe increase in pressure, and there can be a vision drop, decrease in vision. But as I said, open angle glaucoma is more common. Patient does not recognize this, and usually these are the patients who report later to the doctor. So what is most important? Even if you do not have any problems, make sure you meet the doctor, eye doctor, qualified eye doctor, not just an opticals or optician, at least once a year, and get your eyes checked. Now, how should this checkup be? To record the pressure, to put drops into the eyes, dilate, wait for at least 30 to 40 minutes, and then have a look at the retina. If the doctor finds a problem, he will recommend certain scans or tests. Get it done.
Another question I wanted to address today, are there any other comorbidities like diabetes or hypertension that could lead to glaucoma? And are there any precautions that one can take?
Yes, there are certain diseases, like you said, diabetes, hypertension. Definitely, there is a higher risk of glaucoma. There are certain other diseases, like kidney disease, autoimmune diseases, where the chances of glaucoma is higher, either to the disease itself or to the medications we use in the form of steroids. The other things, as I've told you, use of steroids, use of certain other medication. Steroids directly increase the intraocular pressure in the eye. There are certain other medicines which reduce the blood flow to the eye. These are also important. And those medicines, some of them are antihypertensive. For BP, they take these medicines. So these are the systemic conditions that affect the eye. Again, I emphasize on this point. Number one, you have to reveal all these conditions to the eye doctor so that he does appropriate tests to find out whether you have glaucoma or certain other diseases also of the eye. Number two, You should also reveal what are the medications you are taking for these diseases. And number 3, most important, get your eyes checked frequently.
And lastly, could you address a few myths about glaucoma?
Yes, there are various myths involved with glaucoma. Number 1, as we already said, people feel that this is an age related disease. Yes, it can be an age related disease, but we are seeing lot of younger patients, in fact, even children, develop glaucoma early in childhood itself. So, age is not the only criteria. Even younger people should have their eyes checked regularly. The second myth, let us go to a doctor only when the vision is affected. Again, this is wrong, because by the time the vision is affected, already we have lost the battle. There's no way we can treat it. So, the earlier you present to the doctor, the better it is to treat glaucoma. Even without any symptoms, have routine checkups, particularly if you have the history, what I had suggested before, such as history of a family member having glaucoma, frequent change of glasses, high myopia, high pressure in the eye, or if there is any diabetes, BP, or other systemic diseases, or if you're taking medicines for any other reasons. Now, third myth, after treatment, people feel that once it is treated, glaucoma will go away. Sorry, no. What we are doing is only keeping glaucoma or keeping the pressure under control. So, glaucoma is a lifelong disease, just like how diabetes and BP are. And you will either have to take medicines or get a laser done or get a surgery done or a combination of all these things throughout your life. The fourth myth, what I would like to add, some people after surgery never come back. But remember, even after surgery, glaucoma can progress, in which case we add a milder drop, one drop, or maybe a lesser concentration of the drop to maintain it throughout. Summing up, glaucoma, there is no age limit. Number 2, there is no cure for glaucoma. It can only be controlled. Lifelong follow up is required. And because of these reasons, don't wait for a symptom to develop. Don't wait for your vision to go down. Consult the doctor on a routine basis. And finally, of late, we are seeing even educated patients undergoing eye checkup at various optical chains. This is wrong. What they are checking is only your power, and that also many times it's inaccurate. So, as I said earlier, what is required is proper checkup by an eye doctor after instilling drops into his eyes, into the patient's eye. This is what is required. I hope all these discussion are taken forward. It has improved your knowledge of glaucoma a little bit, of the patient's knowledge of glaucoma a little bit. There is a study that has been done internationally where they've compared a person presenting early, meaning a glaucoma that was diagnosed very early and treated. He can maintain vision lifelong. However, if the treatment is delayed by even a few years, even 5 years, we call this vision at the end of 25 years, quality of vision at the end of 25 years, that is significantly affected. But a person who is diagnosed with glaucoma early, he can retain the vision lifelong. Again, I would like to emphasize, all patients should have their eyes routinely checked up, not just for power, but the retina, pressure, and all other important things. Thank you. for the opportunity.
Well, we hope this conversation has helped you understand glaucoma a little better and why regular eye checkups are so important. Remember, early detection can make all the difference in protecting your vision and your loved one's eyesight. Share this episode with your family and friends. Let's spread awareness about glaucoma. Until next time, take care of your eyes and stay healthy. For more information, follow us on @iMattersDaily. Thank you.